Walking less because of back and leg pain? It may not just be aging. Some of the biggest advances in spine care begin long before patients ever hear about them. They're developed, tested, and refined by physicians working together.
I'm here today in Florida getting trained and being part of the team with neurosurgeon, orthopedic spine, and another interventional pain doctor. We are now developing and been trained, certified on a procedure called Endoscopic Less Invasive Decompression surgery. You got back pain going down your legs, and you're getting some pinched nerve, and you can't walk too far. You have to sit down to get any relief. Those are symptoms of something called spinal stenosis. We have been trained and we have been part of creating this new future technology where you do not have to be cut open. You can get a tiny incision right here, just a little bit, and we can go with this system that we have developed with a little tube and shave off the tightness, the arthritis that has developed around the nerve, the bone, so we can just take it off without cutting. Now, there is no recovery time. This is the most easiest thing you can get, and you can start walking straighter, walking longer. So I'm glad, I'm proud, honored to have learned this technique and be part of developing this technique.